So, I'm Dr. Aishwari Durga, practicing obstetrician gynecologist, infertility specialist, and laparoscopic surgeon at Sreemanju Hospital, Kukatpalli. So, today I'll be talking about the various cancers, the gynecological cancers, which can be a part of a woman's lifetime. So, out of the most, what all the cancers a woman can have means it can be a cervical cancer, it can be a uterine cancer, that is endometrial cancer, it can be ovarian cancer, it can be a cancer of vagina, cancer of vulva, and very rarely a fallopian tube cancer. So these are the various cancers which can happen gynecologically in a woman's lifetime. But of these all, the most important is a cervical cancer. And what do you mean by a cervical cancer is a uterus has a lower part of the uterus is called as a cervix, and a cancer of this part of uterus is called cervical cancer. So why am I talking about this? So out of the whole of all these cancers which I mentioned, this is one of the most important because this is preventable. This is preventable, I mean it can be diagnosed by a easy screening test. Screening test ante it is not something which is a very big test, but it can diagnose a big cancer. And why is the need for this screening test? The screening test is needed because we can diagnose the cancer quite ahead of the cancer developing. Like usually a cancer doesn't start overnight. It is a chronic time consuming process. So for example, what is a good point about cervical cancer is it takes around 10 years from the start to flourished cancer. So these time we can use for screening, and if we identify it earlier in early stages, it is very well treatable with almost a very good success rate. So that is why there is an importance of screening for cervical cancer. And how can we screen about this cervical cancer is by the use of various techniques which can be used, like cytology, or it can be also with pap smear and a HPV DNA testing. So these are the most important things which are used for diagnosing a cervical cancer earlier. So where the patient doesn't even have symptoms and we can diagnose the cancer, we can pick the cancer and therefore we can treat them earlier. So if I say there are around 500,000 of women who are diagnosed with this cancer every year with a high mortality rate if undiagnosed. That is the reason we should be very cautious about undergoing a routine screening test for diagnosing this. And I think you must have been heard about pap smear test. So that pap smear test is done for this screening itself. And how and when to do? Usually the guidelines recommend we have to do this testing of cervical cancer screening every 3 years, that is from the age group of 25 to 49. That is if the tests have been negative. If they have been positive, then obviously we have to change our line and manage accordingly how it comes. So if it is negative, every 3rd year till the age of 49, and after the age of 49 till 64, every 5th yearly a woman should undergo a cervical cancer screening. So now once you undergo screening and if it comes negative, just follow this algorithm till your age of 65. And then if it is positive anytime or anything which suggests us to further investigate, a doctor will tell you accordingly. Now comes the second important part. Cervical cancer prevention. Prevention means we have a vaccine for this cancer. This cancer is usually caused by human papilloma virus. It is a virus which acts over a period of time, changes the cells of the cervix into cancerous cells, and therefore we have a vaccine which can prevent this cancer. So there are two things. One is a prevention by vaccine and another is early diagnosis by these pap smears which can prevent a cancer, which can prevent an advanced cancer, and therefore we can treat it, and so we can have a very good outcome from the cervical cancer. So who are all eligible for the HPV vaccine? Now usually HPV vaccines are of two types. HPV vaccine can be a bivalent vaccine or a quadrivalent vaccine. So there are four most common types of this virus which causes the cancer, like HPV 6, 11, 16 and 18. These are the types which are the most common ones who are responsible for cervical cancer. And therefore a quadrivalent vaccine is the best one, which can usually cover up all the four types of viruses. And who should take this vaccine? Usually both boys and girls or men and women are recommended to take this HPV vaccine. Yes, you have heard it correct. It is for both boys and girls. That is because the HPV infection can be transmitted from a male to also female, and that can be a reason for her cervical cancer. And therefore, when should one receive this vaccine? Usually, an age of less than 15 years, there are 2 doses which are sufficient of this vaccine, that is now and at 6 months of gap. But for those who are above 15 years, usually 3 doses are recommended. And for a quadrivalent vaccine, we usually recommend a dosage at 0, that is today, the next dose at 2 months, and next dose at 6 months from the first dose. So this is the HPV vaccine. So this is about overall how to prevent and how to early diagnose this cervical cancer. And believe me, this is the only cancer which has this screening, easy screening options. Rest other cancers which I mentioned are very difficult to screen. They usually get diagnosed with major investigations, biopsies and all. This is a very easy OPD procedure, pap smear. A woman can directly walk in out of her office to a hospital's OPD and just get her pap smear done, which is hardly a 2-minute procedure, and she'll be fit to know whether that report is negative or if she needs any further consideration. So everyone should follow this cervical cancer screening program so that we are healthy. Thank you.